Hi, I'm Robin Boyce, and we've got a lot of great things to talk to you about. First off, Oasis Everywhere. Come on back and find out about that. And 100 black men are making a great impact in the community. Come on back. Back in the studios, we're still Zooming here on City Corner. I'm so glad you can join us this morning. My name is Robin Boyce, and with me right now is Mr. Paul Weiss, who is president of the Oasis Institute. Hello, Paul. How are you?
Hi, Robin. Thanks for having me on.
I really appreciate you coming on and talking with us a little bit more about the Oasis Institute. Tell us a little bit more about the Institute and what it is.
So, the Oasis Institute is a St. Louis nonprofit founded nearly 40 years ago. 40th anniversary will be in 19. And we were founded in 1982. So next year is our anniversary. We focus on successful aging. We have three primary program areas: lifelong learning, very broadly conceived, everything from art to film to health to current events, foreign language, dance, music. And then the second column is active lifestyles. We do exercise programs, evidence-based health programs, evidence-informed programs, health education, habit change for older adults so they can be healthier and age successfully. And then purposeful volunteering. The largest iteration of that is our intergenerational tutoring program. In St. Louis, we have over 2,000 students, 2,000 seniors during a normal year. Our older adults are in schools doing literacy, tutoring, and mentorship with kids K through fifth grade in 25 school districts throughout the St. Louis metro area. It's been a little different during COVID. But those are the three things we do broadly conceived. We're all about aging well.
Yes, now I like that. All about aging well, and that's really what people should concern themselves with is really learning how to do that in the best way they possibly can because it's no joke getting old, okay? No joke whatsoever. So within the Oasis Institute, there is a concept called Oasis Everywhere. So is that what it is you're talking about? Tell us more about it.
So Oasis has traditionally, both at our national headquarters here in St. Louis and all of our centers across the country, we've delivered almost all of our programs in person. You know, for some of our programs, it's an occasional webinar, but we've been an in-person experience for older adults to connect with ideas, education, each other, kids intergenerationally. And last March, when COVID-19 hit, we had to immediately suspend all of our in-person programming across our entire national network and in St. Louis. Luckily, we had been working the previous 4 years on a live streaming project where programs from our national network would be shared among centers. And we did pilots of that and learned a little bit about how to do live stream programming. We, however, were not prepared for launching a whole different version of our business, but necessity is the mother of invention. Pandemic creates need. So we launched a virtual center called Oasis Everywhere, where everything Oasis does at all of our centers around the country was aggregated for live interactive experiences for older adults to learn, to move, and to socially connect in our virtual center.
So actually, the whole COVID pandemic actually boost up or help create within your organization a whole nother entity to it then.
Yes, we had 9 national centers. We operated programs in 250 municipalities, but we never had a virtual center that could reach the entire United States, and now we do. And we think we are going to be dual venue, in person and online, forever. It's been, launching a business like this and building and getting older adults engaged in new technology has many, many barriers and challenges. But
Yes.
now we have well over 1,000 unique participants taking thousands of classes enrollments a month, and we're still adding as the pandemic recedes. 3 to 5 people a day are joining to continue to participate, and we're starting to build relationships and partnerships with other organizations to reach their population. Obviously, lots of barriers to doing this in a really big way. The
Right.
first, obviously, is that older adults are often seen as not being as technologically facile.
Right.
And a little bit of that is myth, a little bit of that is real.
Yeah, yeah, a little bit of it is myth and a little bit of it is real, but then I think it's difficult for all generations as well, except, you've got some of the younger groups who get it just a little bit faster. But one of the important things that we talked about before coming on the air is that contact that older citizens really need that they aren't getting even in normal times. But Oasis, of course, opened that door for seniors to have contact with other people.
And that's I'm very happy that you spoke about that in terms of reducing social isolation. One of one of the fundamental things that we focused on at Oasis Everywhere is every single class is a live experience. An exercise class, a music class, an art class, a history class, a technology literacy class, they are all live interactive experiences. We have played with recording content for on demand, but our first goal was reducing social isolation. And you only do that if your virtual experience involves you seeing and being seen, you hearing and being heard, the ability to ask a question of an instructor, to ask for a little help when you've had problems in a technology literacy class, to see artists and musicians, and to engage in film in an interactive way. And so we do this by we have an instructor, we have a host. The host really follows the chat, brings questions to the instructor. When I teach a class on Oasis Everywhere, I actively stop what I'm doing to answer questions. And then at the end, I open it for discussion. I want everybody to, who are you? Where are you from? Carol from Florida, Barbara from Florida, Barbara from Missouri. And so we try to figure out where everybody's from, understand the context of their questions. Right. And in doing that, you reduce social isolation. You get this learning and social connection piece. And that's our goal.
And that's what people really like. They like that connection, and they like that people are able to understand what they're talking about, or they may have been looking at something on television and really needed to discuss that with somebody. And having discussions like this, or taking some of the courses that you all offer, opens their minds to probably that conversation they really wanted to have with someone.
And that's what we really hope for. We hope two things happen: that someone joins a class in a topic they're interested in, and they connect with others around that topic, learn from the instructor, get off, and continue to be interested. They continue to investigate. And they'll return to us because we have these large product categories. It's hundreds of classes a month. So if you're really interested in art history, for example, or if you're really interested in literature, there are many opportunities to engage in that interest area with like-minded older adults, and they often see each other again. We find classes within a category tend to attract people who are all interested in that category, and you build these relationships. You are sharing an experience with someone, which during the pandemic has not been easy to do.
Yes, this was has been a very difficult year, and we probably maybe have 18 months more of having to get back to halfway normal at this point in the game. When it comes to that and being able to stream and get information out here and hire these people to do these things, do you have to go after sponsorship dollars as a nonprofit organization to make sure you're flowing these things, and how does that work for you?
Sure. Oasis is dependent on philanthropy to deliver what we do. Oasis Everywhere has some free classes, but most are fee-based. They're well below market, sort of the $3 to $15 range. And but there are several barriers to this. One of the things we strive to be is to serve a diverse audience. The clarity of the digital divide has never been more transparent now than because the pandemic revealed all of the audiences that are divided by this digital divide, where you have older adults and older adults who are lower income, who don't have the devices, the skill set, the experience to engage digitally. So one of the things we are addressing is we are a technology literacy educator. It's one of our biggest programs pre-pandemic. We're trying to figure out a path forward now to really apply our technology literacy experience and content to helping older adults, especially lower income populations who tend to be underserved by technology, to engage with us and to engage with technology as a socially connecting tool. So this is a big push right now, and it's been made so obvious that this needs to be central to our work.
I bet you could see that, when you all started these courses and started getting things going, people calling and saying, I can't get connected. What kind of phone do I need to use, or what kind of computer do I need? Were you getting those kind of calls from seniors saying, I need help?
We had to immediately set up a help desk to answer questions and be available by email and phone. We believe that help desk will need to grow. We're going to need to find funding to continue to expand that.
Yes.
We are very interested in expanding that work, because the older adult who calls technical support for Apple or for Android, or for what they call Verizon, those people are not trained specifically to work with an older adult audience. And an older adult tends to enter technology at a different time of their lives and at a different skill set level and comfort level and confidence level. And so one of the goals of our help desk is, you can ask us the same question 10 days in a row. We're going to answer it for you every single time, like you're our best friend and you are our responsibility.
See, now that's great. A warm and fuzzy organization. That's what people really need right now, is warm and fuzzy. What can people do to help you all out? What can people do to get more people involved with reference to, I know mom and dad, they're sitting home not doing anything. There's so much we can do now that everybody's getting vaccinated and we're moving forward, thank God. How do people get folks involved and connected with you all to move forward, whether it's philanthropy and helping you out financially and or participation?
We are always open to gifts. But the most important thing you can do is, if you know an older adult, if you love an older adult, if they are lonely, if they don't feel like they have the technology skill set and confidence to engage in virtual programming, let them know about Oasis. Let them know that we will help them connect through a browser, through a phone, Android, iOS, doesn't matter, any device. Will help them connect to each other and to ongoing learning opportunities. And there are lots of people who are in sort of the middle age of life who have older adults, and you're the technology caregiver for that older adult. Right. I can't get this to work on my iPhone. My online banking isn't working. I've forgotten my password. Oasis is there to support the tech caregiver and the older adult who's engaging with technology.
I like hearing that, because the caregivers sometimes get left out. They're not remembered that they're the individuals trying to help grandpa, or mom and dad get through whatever it is they're going through. I want to thank you so much, Paul, for coming on and talking with us about the Oasis Institute. This is an awesome organization, and we're going to encourage people to give you a call. Get online and stream with Oasis. Get your parents, your grandparents involved, and really, really, let's have a good life here. Thank you so much, Paul.
Thank you for the opportunity, Robin. And I'll just say the website once. It's oasisnet.org. Oasis, the word oasisnet.org. Come find us.
All righty. Thank you so much. We will. I'm Robin Boyce, and we'll be right back with some more great information on what's going on with the 100 Black men. They're making sure people are getting those vaccinations.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Operation Wonder Park is a go!
There's nothing more powerful than imagination. But don't just imagine. Use STEM to change the world.
Who's with me?
Oh, it's gonna hurt tomorrow.
If she can STEM, so can you. Find out more at She Can STEM.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
There's so many reasons to love St. Louis, you can't pick just one.
What I love about St. Louis is the 79 unique neighborhoods and 108 beautiful city parks, including Forest Park, which is actually larger than Central Park in New York, and the gorgeous Tower Grove Park right here.
And there's always something new to experience, no matter the time of day or the season. So come and experience St. Louis.
Hi, I'm Robin Boyce for City Corner. Thank you for coming back. We are now going over to North St. Louis, where we're going to be talking with Mr. Darius Chapman, who is COO of At Home Care Missouri, an organization that's working on getting vaccines throughout the St. Louis area and the state of Missouri. And he is also president of the 100 Black Men of Metropolitan St. Louis. Thank you, Darius, for coming on board. I understand you're over in O'Fallon Park in front of the YMCA over there, making sure folks are getting that vaccine.
Absolutely. Yes, ma'am.
Thank you so much for the work that you've been doing. I heard about what was going on. Probably early April, a good friend of mine called me and said, we're over here getting our shots, Everybody was just letting folks know. How did you all initially get started in letting, because earlier on with the vaccines, folks were just finding out about it through word of mouth. Is that kind of sort of what you all did through a referral basis or grassroots? What did you all do to get the word out that 100 Black Men was organizing to make sure people got vaccines?
Thank you for that question. So a great organization called At Home Care, which I work for, had applied for a mobile unit to do COVID-19 vaccines. And so we were looking for community partners, and gratefully that I was president of 100 Black Men at the time. And I said that the 100 Black Men could organize right in the center of the city of St. Louis to get people vaccinated, and using our platform with all the work that we do in education, health and wellness, economic empowerment, and mentoring to get people in to get vaccinated. And we were able to do that. So we partner with Maryville School of Nursing and the St. Louis Black Nurses Association, as well as our own medical staff here at Home Care to provide the vaccinators. And we were able to do that day. We did about 500 vaccines that day. So it was an awesome day and an awesome way to get started.
That's awesome. That's awesome. Which vaccine are you all distributing? Which one is it?
So we have all three. We have the Pfizer, we have the Johnson & Johnson, and also the Moderna.
So you have all three. And at this point, are you all going to be continue to move throughout the St. Louis city area and possibly in the St. Louis County? Or how are you going to be working this track and making sure people get vaccinated?
So Dr. Vassar had another awesome idea to do a church and community tour. So we've been working through the churches and community organizations. So we've been to Shalom City of Peace, Westside Missionary Baptist Church, First Baptist Church of Chesterfield. We'll be at First Church of I think St. Charles soon. We'll also be at a couple of other venues. Right now we're at the YMCA. Tomorrow we'll be at the Alpha House on 19th in Shrewsbury. And then on Sunday we'll be vaccinating the St. Louis Opera. So we've been on the move.
You all have been very busy, making a really big difference. We are now seeing, as some of the CDC recommendations have come out, saying that people no longer have to wear masks, but still those who haven't been vaccinated need to wear masks. And we're seeing in the conversation that there's still a lot of resistance to the vaccinations. Are you all doing any education in that area with reference to helping individuals understand how important it is to get vaccinated?
Absolutely. One of the things that we're constantly doing is educating our clients and our staff, and also young people. If you're living or visiting your grandmother, it's most important that you're vaccinated, because you are stopping a chance from having a full experience while visiting. We're also doing a lot of social media as well as webinars to make sure that the community fully understands the importance of vaccine, being vaccinated, and the full bluntness of the COVID-19 virus.
Yes, I don't think that a lot of people really do understand that. What are some of the resisting kinds of questions or concerns that you all are hearing?
Well, depending on what community you're in. So in the city, everyone is afraid of, the I think it's the Tuskegee experiment. They're saying that a lot. In West County, they're saying it's not real, it's a hoax. So depending on the culture and climate you're in, and what part of St. Louis you're in, you're getting different things. However, those are still, everything that's being said is still a myth. It's not proven by science that any of those things work. And we need to make sure that we trust the science, and the doctors have put such great work to make sure that we have vaccines to vaccinate our communities.
Why is it so important now that people really understand to trust the science? And how do we get people to do that? I mean, I have never seen so much resistance to science ever.
Well, I believe we're in a free thinking society, and that's great. But being free thinkers, or free people that think freely, we have to also understand that people have went to school and have done the research. And if we are free thinkers, that means we are free to educate ourselves as well. And meaning that education is empowering. So please read and find factual sources of knowledge to draw your base of what you should and should not do. Yes, you should take your vitamins. Yes, you should eat well. But while doing so, you also have to vaccinate yourself as well.
Where can people find out more information on where 100 Black men will be at home care to do vaccinations? You talked about several different sites and places that you're going to be going to in the future. But is there a portal that people can go to?
Absolutely. So for the at-home care, you will go to ahcmo.com. That's athomecaremissouri.com. It's just the initials, ahcmo.com. And there we'll have a plethora of information about vaccines, as well as sites that we're going to do for the next 2 months. You also can go to the 100 Black Men website. That's 100blackmenstl.com. And we'll have flyers posted there as well. But also follow us on our social media. And that's At Home Care, At Home Care St. Louis. And we're always posting there about every upcoming event.
Tell me, what are some of the comments that you hear from people who have gotten that shot? Is there relief there? Are they going home and encouraging people if they're coming back for the second shot, which will be the Pfizer and the Moderna? What are some of the comments that they're making about getting that shot?
Well, it's always quite encouraging to see our community being vaccinated, number one. When we first did our vaccination event at the 100 Black Men, we had seniors that could not get the vaccine, and they had been on lists for months and months and months. So as an organization and partnering with the At Home Care and the 100 Black Men, we want to make sure that vaccine experience is lovely. Make sure that we're doing our very best, that you have no waits, and then that people are courteous and kind and help you fill out the paperwork so that you're understanding what you're doing. The comments I've been receiving, though, is that people feel a sense of relief. They feel a sense that they can move around safely. So we are encouraging, even though you have your vaccine, please still wear your mask. Please still wash your hands. We at my company say the 20 for 20. Every 20 minutes, 20 seconds of hand washing. It's the number one defense against COVID-19.
It makes total sense for people to just basically want to continue to protect themselves. I think that we're probably going to see a sea change in, I guess, germophobia, where people are going to start doing things a little bit differently now when it comes to socializing and when they go out and do picnics or other social types of events. We're going to see some differences here now, right?
Absolutely, and I think it's good because the flu season is still up on us, and sinuses and all so people are now being more hygienic, and that's very important. It's for the safety of us all.
For everybody involved. Now, At Home Care Missouri, this is an organization that basically, do you take care of senior citizens? Are you going to homes to take care of folks, or what exactly do you all do?
So our mission is to making sure that we provide quality health care for seniors and geriatrics and babies. So we take care of the gamut of the population. We want to make sure that we keep our seniors out of the nursing homes and into their home homes, so they can have a sense of comfort while we provide quality care in their homes.
So you are definitely making a difference in the community and making sure that people feel comfortable in their homes, feel comfortable in their communities. And now you're going to be going to the churches so folks can feel comfortable in their churches.
Yes, ma'am. Absolutely. The house of worship.
Then the house of worship where folks can go in and really sit down and have a good time with the Lord, praise and worship. I mean, a lot of folks miss that. A lot of folks miss being able to get into a church, but now you all are going to be making sure that folks can get vaccinated at church now. Did I hear that clearly?
Yes, and how befitting that when I was a kid, they said the church was the saints' hospital, and to see the church convert itself to a clinic to where people can receive a vaccination so they can remain healed and free and safe, and so to see this great work and the community come together, the full community come together on one purpose to have safety for our community. This is awesome work to see all the pastors that have opened their doors to allow us to be there. The nursing board and the ushers are doing a different work. They're escorting people to the vaccination seats instead of the seats in the pews. But it's still, people are now being socialized, and it's just amazing to do.
It is amazing. So people can hit you all up at Home Care or either 100 Black Men to get you all over to the churches?
Absolutely. Absolutely. That website is ahcmo.com. And then the 100 Black Men website is 100blackmenstl.com. Now, the 100 Black Men is a non-for-profit organization. Yes. So to do the work, we do need donations. And if you could help us in any possible way, that'd be great. At Home Care is an entity. If you need someone to take care of your loved one and your seniors, we're here to do that, as well as make sure they receive a vaccination.
Thank you so much, Darius, for coming on and talking with us about what 100 Black Men is doing in the community along with At Home Care. I really appreciate you. Continue the good work. Thank you so much.
Yes, ma'am. Thank you for having me.
Yes. And thank you so much for you all joining us here on City Corner. We'll see you next time here on City Corner. I'm Robin Boyce.